And a Harvard research study finds Black people are 3 times more likely to be killed by police than white people. And May is Mental Health Awareness Month, and seeing constant incidents of police brutality can take a toll on your mental health. Joining me now is Dr. Erlanger Turner, psychologist and assistant professor at Pepperdine University. Thanks so much for joining us, Professor.
Thank you for having me.
We're glad to have you. Well, as you know, every day you turn on the news or look at social media, there's countless cases of police brutality in Black and brown neighborhoods. These images can take a toll on people. What are the signs and how can it be prevented?
Absolutely. One thing that we know from the research related to police violence is that when it's witnessed by the Black community, oftentimes they do report more stress or mental health symptoms compared to their white counterparts. And that's been shown from decades of research. Some of the signs that you may be experiencing difficulties may be difficulty sleeping, problems concentrating, and for those that may have had previous experiences with being stopped by police, you may also begin to feel physiological symptoms in terms of like increased heart rate or difficulty breathing when you witness some of these events.
And we know that talking to a therapist, of course, can help with mental anxiety, but there are some people in the Black community who will rely on each other for help or talk with each other rather than talking it out with a therapist. They might feel uneasy about that. How can you help people get through that sort of anxiety or feeling of discomfort when it comes to talking to a professional?
Absolutely. I think it's great to be able to talk about these events with people that are close to us, and it's for example, family and friends, because we know that they can understand our challenges and experiences. But I also think that it is helpful to talk to a licensed mental health professional or psychologist. And so if you yourself or you know someone who may be struggling with mental health difficulties, I always tell people to at least reach out to have a phone call or do a consult with the provider just to see if they are a good match for you. That gives you an opportunity to talk about your mental health with that person to see, are they the person that understands your difficulties? Are they comfortable talking about race and racism? And can they be able to provide that support that you need in terms of identifying coping skills?
And what about the church? Black people often turn to the church for help. So what role can the church help in terms of healing the community?
Absolutely. I actually just published a paper in the Journal of Black Psychology with some of my colleagues that really looked at what is the role of the church, specifically in terms of spirituality, with being able to help us heal. And we know that having that spiritual connection and religious things, religious practices such as prayer, can be really helpful. And so I think the church can be a really unique community that really is helpful for us in terms of getting that emotional support, having that connection that we know is also important for us as a Black community, and also being able to engage in things that can support our optimism and our hope about the future.
And we talk about a lot about the anxiety, fear of the police, but what about our actual officers who are men of color, men and women of color, who wear the badge? How is all of this affecting them?
Absolutely. I think we've seen it in several instances where there are police officers of color who also report having challenges sort of navigating their duty to protect the community, but also being able to accept their own identity. And that sometimes can be a struggle for them because they may be coping with their own mental health difficulties in the midst of trying to also do their job. And so I think it's important that, we do need to have some reform with policing so that officers can also get the mental health support that they need because oftentimes those individuals are oftentimes overworked. They don't have the support that they need. And so they may be struggling with their own challenges, which is going to make it much more difficult for them to do their job. And so I think it's important for those officers to also have the support that they need because we know that PTSD, or post-traumatic stress disorder, also tends to be much higher in the Black community than the general population. And that is the result of experiencing, some of these incidents in terms of these violence.